Well, there was yet another attack on the TTC this weekend. A man allegedly assaulted a worker at the Eglinton West station after being told buses were no longer running. Violence on public transit has been a theme in Toronto lately, but it's happening across the country. Mayor John Tory has demanded a national health summit to address some of the concerns of how to manage social issues on transit. David Cooper is an adjunct professor of transportation planning at Toronto Metropolitan University and a transit consultant. He's a leading researcher on social issues and transit in cities across Canada, and he's in studio with me right now. Good morning.
Thanks for having me.
Great to have you here. So, tell us about the research you're doing on transit safety.
So for the past 6 months, I've been leading a national study looking at some of the broader societal components, looking at safety and sometimes disorder in public transit. There's been a huge conversation when it comes to mental health, when it comes to the unhoused, when it comes to addictions, and how does this actually impacting ridership on public transit, the perception of safety, but also what is the response we're seeing from transit agencies and governments when it comes to these three very complex and broad issues we see playing out in our transit stations and buses across the country.
What impact has the pandemic had on what's happening out there?
So there was a substantial impact with the pandemic. We saw really a collapse of ridership at the beginning of the pandemic, about 20% of pre-pandemic ridership we saw at most transit agencies across the country. Right now, we're hovering around 70-80%. TTC is about 70%. Metro Vancouver is around 80%. Same thing with Edmonton and Calgary. But one of the challenges that occurred is that public transit was one of the very few public spaces that remained open. It was one of the few spaces that people could sometimes go to feel safe. If it was a place that some people sheltered in. And we're at this really interesting crossroads where we're getting emergency funding from the federal government, provincial government for the offsetting of revenue. But now people are starting to feel potentially unsafe. And we're at this precipice or this point where we want to encourage people to come back to transit, but we need to address the safety considerations. But some of them have been connected to more broader societal components, and some of them might not have been.
Do you ride TTC?
I ride TTC, and I ride public transit in every city that I go to.
How safe do you feel riding TTC?
I do feel safe on the TTC. I am a little bit more aware of my surroundings, and as a person who I spent 15 years working in public transit agencies before I started my own consulting company. So if there was something that were to occur to me, I kind of know how to deal with it in terms of getting assistance and help. But there is an increased awareness that I see customers having. I teach 2 classes at Toronto Metropolitan University. One of them has 50 students in it. And one of the big conversations we have every week right now is about safety, because my students also have the same considerations and thoughts on the topic as well.
What do you hear from them?
There's concern. For us, it's a big city planning issue. If we don't bring people back to public transit and people choose not to come back to public transit, there's some pretty negative externalities when it comes to going back to driving, when it comes to different commuting patterns. And for transit to be successful, has to follow three key principles: being clean, safe, and reliable. And a whole bunch of those considerations are really at play right now, and it's something that as planners, we want to ensure the best of our transit system, but we need to get the support to do that.
You talked earlier about the fact that some people come to public transportation or public transit, in this case TTC, for that feeling of safety. For in some cases, if they're unhoused, to get in out of the cold and to get some warmth. These are not new issues, right? These are things that have been happening for a long time on TTC. But how are these issues tied to the violence that we're seeing on transit?
And that's where we're trying to figure out if there's a connection or not. I've been out with some frontline staff with various different transit agencies across the country and have spoken to people who shelter in transit systems and transit stations. And is it a conversation of perception? Do you feel unsafe because you see people that are living in stations or sheltering themselves in stations, or do you not, right? And one of the conversations that was very eye-opening to me with speaking with those who have been sheltering in stations is that they actually feel safer in the stations. It's challenging to get access to shelters. It's challenging to get access to certain mental health services. And more so maybe in other cities across Canada on transit, we're having a pretty substantial issue with the opioid crisis. So there's a sense of community that people may have within the transit stations, but also we can't have certain situations occur in our transit stations and then also kind of have knock-on effects to how people feel safe or not safe on public transit.
So everybody's safety is a concern here. here. I mean, we want those who are sheltering on TTC to feel safe, as well as those who are using TTC just to get from point A to point B to feel safe. What are your recommendations then for building safer transit overall?
Well, there's been a big conversation here, and Mayor Tory has brought this up in terms of having a national conversation on mental health. We need to take it more broadly. We need to look at some of these huge societal components that are really playing and interacting in our stations. So that's mental health, that's substance use, that is housing. These are levers that are controlled by the provincial and the federal government. Cities cannot do this on their own. We've seen a number of measures that have been brought into transit systems across the country. A lot of it's been bringing in more police, more security. Those are enforcement activities. These are things that are a reaction to what we're seeing on our systems, but we need to actually drive the conversation into some of the broader issues that are complex. They're going to require funding, and they're going to require tools that are not at the disposal of the city. They're at the disposal of the province and the federal government, and they need to step up to the table and help cities on this. They're funding emergency funding. We need them to come to the table when it comes to addressing substance use, mental health, and housing. The cities cannot do it on their own. The transit systems can't do it on their own.
What does that look like, though, to handle those things on the TTC? I mean, you mentioned the police. The TTC has announced more police. I believe it's 80 more police who are going to be on and in the TTC. What does handling the root causes of these problems, handling addictions and those sorts of things in this system look like?
Well, they're not enforcement issues, and you bring in police for enforcement. And some people may feel a perception of safety by seeing police, and some don't. And there are programs across the country we're seeing on transit, and we're seeing TTC is actually doing this too with the Streets of Homes workers, that you require the wraparound support, the continuity of care, so that people can actually access proper housing supports. We have 85,000 people on a wait list for community housing here in Toronto. That's not something the city can deal with their own. There are 600 providers of mental health services in Ontario. If I was trying to figure out how to access one, it's complicated. You call 211, it's very much a triage-based system when it comes to dealing with an immediate issue. We need the wraparound supports and the continuity care and the case management on this, which is way beyond the resources that we have right now. And then on substance use, we need to address, especially more so in other cities across Canada on public transit, the opioid crisis, which is something that is a health issue. That's not something the cities are equipped to deal with. So, and having this all together in one strategy, we don't have that. There's been calls of a national task force. We should be doing that. We should have in that conversation. We need the province and we need the feds together on this, because it's also in their interest to bring people back on transit.
Just before I let you go, these are all great ideas for things that will handle some of the root problems, though. In the meanwhile, is there any recommendations to that would be more immediate, that would help prevent some of these attacks that we've seen out there?
One of the things that's very timely in Toronto is we have a budget before the TTC board, and there is a pretty substantial service cut. In order for people to feel safe, crime is based on opportunity. And if we have less service on the subway service, there's a 16% cut to the subway service from November service standards of 2022. If we put people in a situation where there's less visibility, less staff, less ridership, and also less service, which then incurs additionally the negative externality of less ridership, we're putting ourselves in a more questionable spot. We need to address some of the operating challenges. You know, nobody wants to cut TTC service. I don't think council wants to cut it, or the board, but they're in a tight spot. We're getting substantial money to offset revenue, but also we need to address that issue and ensure we have the visibility, the service that people come back. And that is one of the immediate things that we need to address here in Toronto.
David, a pleasure to meet you. Thanks for being here this morning.
Yeah, thank you for having me.
David Cooper is an adjunct professor of transportation planning at Toronto Metropolitan University and the principal at Leading Mobility Consulting.